Welcome, our dear viewers, to a new episode of Medipedia, in which we will be discussing health-related matters with our virtual guests. And today's episode will be in the scope of the pandemic that has taken over our lives lately. Hi, Dr. Tara.
Hello. Hi, Ali. How are you?
Good.
How's everything?
Good,
Thank God.
good.
So, yeah, dear viewers, in this season of our program, where we will address health topics that concern everyone. So, before we start with our first quest, so let's watch this report. Stay tuned.
Coronaviruses are a large family of respiratory viruses that can cause illness in people and animals. In rare cases, coronaviruses that circulate among animals can evolve and infect humans. In turn, these infections can easily spread from person to person, as was the case with severe acute respiratory syndrome, or SARS-CoV, and Middle East Respiratory Syndrome, or MERS-CoV. The virus is primarily transmitted from person to person by coming into contact with an infected person's droplets. When an infected person coughs, sneezes, or exhales, droplets are expelled and can land in another person's nose or mouth and inhaled into the lungs. The virus can be transmitted by an infected person not showing symptoms of illness. This is why it's important to stay at least 2 meters or 6 feet apart. The COVID-19 pandemic in Kuwait is part of the worldwide pandemic of coronavirus disease caused by severe acute respiratory syndrome coronavirus 2, or SARS-CoV-2. The first confirmed case in Kuwait was announced on 24th of February of 2020. Kuwait ended the full curfew on 30th of May and started taking steps toward a gradual return to normal life by placing partial curfew. This step is a first of 5, with each phase tentatively lasting for 3 weeks, which could vary depending on the assessment by the Ministry of Health. Keep up with the updates and stay safe.
Hello and welcome, Dr. Muhammad, a family medicine physician at Dahman Health Assurance Hospital Company. So, Dr. Muhammad, how are you? How is everything?
Assalamu alaikum. Thank you so much for inviting me for the session. I'm doing well, thank you.
You're most welcome, Doctor. So, regarding the gradual return to life normally, how important is it? What do you think about it?
Yes, I think it is very important that we take the guidelines provided by the MOH for gradual returning back to normal. The reason why this is being done is first to prevent crowding and to prevent people from coming in close contact. And second, to make sure that the ministry and the health authorities have enough time in case there is a new surge of the cases moving up again. So that is why the gradual movement is very important, and all of us are requested to follow the MOH guidelines as they have been saying, inshallah.
Inshallah.
Dr. Muhammad, as part of our government plan to go back to normal life, we are going to be entering phase 2, or probably we have entered phase 2 already. What does this signify?
Entering into phase 2 means a successful completion of phase 1, which means that the past 3 weeks plus 1 week which we had provided for phase 1 has successfully managed to contain the disease to a great extent, and we are now ready for taking the crowds and the management of getting back to work better than what we were in the last week. So inshallah, it is a good sign for us that we have moved to phase 2, and I hope inshallah that we will move to the next phases as planned in the required timeline, inshallah.
We hope so too. Thank you.
But regarding the phases, it's always, I think everyone knows that the minimum amount of time for each phase is 3 weeks. Why is that, doctor? Why is it 3 weeks?
Yes, there was the incubation period, which basically means what is the time that the person may get infected after he has been infected by the virus. So the time he starts showing symptoms. So normally the COVID-19 gives a infective or incubation period of about 2 to 3 weeks. So I think the reason why the MOH has chosen 3 weeks is probably because of that, so that we have that window period to pick up new cases and inshallah contain them at the right time.
Inshallah.
Dr. Mohammed, I'd like you to focus on the role of people themselves in making the transitioning from phase to phase a successful process.
Yes, like all of us are aware that this particular disease is called a pandemic. The meaning is that it is everywhere and everybody is going to be affected. And like we all have seen that the effect of the lockdown has affected every single person in Kuwait and all across the world. So it is but obvious that every person has a responsibility towards contributing to containing the spread of the disease. So the participation of every single person, no matter where he comes from, as long as he is staying in a community, it is very, very important that we adhere to the guidelines provided by MOH and the health authorities.
Fair enough.
You know, Ali, I think that as a part of community, we all have a responsibility toward this issue. All of us, we have to uphold and follow the rules of Ministry of Health.
And honestly, the TV and radio have been doing extensive awareness campaigns in order to make people understand that each one plays a role and how important it is, because we all live in one society and it's all integrated, and not even just our society, the whole world is going through this. So it's yeah.
Yes, alhamdulillah. I'm happy that the MOH has been proactive in its creation of awareness in every activity. In fact, I'm new to Kuwait. I've been here just 6 months, and I'm very, very happy with the way things have turned out here. And it's much better than the rest of the world, I can say that.
That's good to hear from you, Doctor, to be honest.
Yeah,
that's a good thing.
Since you enjoyed it here. So thank you so much, Doctor, for let's go after this report, and then we'll continue with the questions.
For your health and the health of those around you, here are the guidelines to follow during your home quarantine period. When arriving at home, do not greet family members by shaking hands. As close and direct contact with them should be avoided in order to protect them. Go straight to a separate room with its own bathroom and adequate ventilation via windows. After entering the room, put your clothes in a plastic bag and close it tightly. Then dispose the gloves in the room's waste bin. Keep cleansing hands constantly and always avoid eye, nose, and mouth contact. Please observe the etiquette of coughing or sneezing and keep the handkerchief on hand. Use it to cover the nose and mouth or cover them with the elbow. Make sure to wash your hands with soap and water in the correct manner for a period of 20 seconds. And use paper towels to dry them. Always avoid meeting on dining tables with home members throughout the period of the home quarantine and have meals inside the room. With the need to use disposable plastic utensils, it is necessary not to share personal tools with home members. Take care not to move around the home and avoid contact with the elderly, children, and patients with chronic diseases. Take care to clean the house and wipe surfaces, focusing more on the places used frequently. If a toilet is being shared with the quarantined individual, it must be cleaned continuously. Using disinfectants such as diluted home-use chlorine, 1 unit per 9 units of water. When contact with others is unavoidable, please consider wearing the appropriate mask as shown. During the 14 days, the case is contacted and visited periodically to ensure compliance with the home quarantine measures and to perform a health examination and observation to ensure that it has no symptoms. In the event of any feeling of ill health, please call 151 immediately to undertake the necessary procedures. We hope that everyone adheres to the guidelines in the interest of your health and safety and to preserve the health of society. We ask God for safety and recovery for all. With greetings from the Ministry of Health, Health Information Office. Home quarantine is a national duty.
So hello and welcome back. You know, Alia, in the last few months I've been working in a field hospital in fairgrounds. It's not that easy, you know, as I saw in the report with the advices regarding how to clean yourself, how to protect yourself. It's not that easy, to be honest.
No, it's not.
It's
And
always
the
an issue.
Number of people that you're dealing with as well in the hospitals must be overwhelming, and it's stressful as well. I really appreciate that. Yeah.
So, Dr. Mohammed, back to you with the questions. So, what do you think regarding the period that COVID-19 will last? In your opinion, how long does the effect take?
Things are moving today across the world and in Kuwait. I believe the effects of COVID-19 will last for quite a long time, maybe for a year as well from now. Some countries, it may last for 2 years also, by which I mean that there is going to be a new normal. We will not be having a normal life as we were earlier. We will have to maintain social distancing for a longer time, maybe continue to wear masks, continue to have these hand hygiene measures and prevent crowding for as long as possible, depending on the situation around us. But the way MOH has been working in Kuwait and the way things are improving here, I believe in Kuwait, inshallah, by the end of the year, we should be fairly out of the situations in Kuwait, unless something else comes in again. So far, I think by end of this year, we should be fairly back to normal in Kuwait, inshallah.
And what do you think regarding the factors that play a role in this? What decides if it's 1 year or 2 years? What do you think about that?
What decides it is the number of cases rising in Kuwait, and if we are able to get a control on the number of cases in Kuwait, and if we are able to track every single new case effectively, and if people also contribute in a way wherein they contribute with following the guidelines of MOH and reaching out to us as and when they have any symptoms of COVID-19 as early as possible. So it's a mix of good governance and good amount of public participation in these activities, inshallah. So that will ensure that we will be able to reach the end of this pandemic faster.
Hopefully we will.
Can I actually pick up on your question?
Yeah, go ahead.
I'd like to ask you, Dr. Mohammed, regarding the strains that are being discovered in Russia. For example, I just heard that they discovered 20 new strains in Russia, and they've discovered new strains in Asia and Europe. Does that really affect the future of COVID-19 with us?
Yes, it will. COVID-19 is very similar to the flu virus. So in the way it spreads, in the way that it can also infect people. Another important thing which is similarity between flu virus and COVID is that they can have multiple strains. So yes, the strains can be different every time. And every region has showed a different kind of a strain happening, and the way the people fall sick is also slightly different than the way other regions have had. For example, Southeast Asia, we have had people with no respiratory symptoms. I've had people with more of abdominal symptoms, with loose motions and tiredness and all that. So yes, this is something which is new, and I'm sure that with the upcoming research, we'll be in a better position to handle that, inshallah.
Right. So from your experience, Dr. Mohammed, is there any proven medicine to combat COVID-19, whether inside Kuwait or outside? Do you have anything proven up to now?
There have been multiple trials across the world in various countries. Some places, like you said, there are different strains. Different strains sometimes respond to different treatments. But as such, for any treatment to be said to be working and certified as the most preferred treatment, it requires a longer time and a longer studies required to be done on that. So far, we have not been successful to come up with one single such treatment which would work. And there is no preventive medication also. The only preventive thing that we can do as a common man and as a common person is to follow the guidelines of social distancing, wearing the mask, and being socially responsible towards these guidelines which the government and the health agencies are asking us to follow, inshallah.
Fair
Yeah,
enough.
it's
So
not
it's all experimental up to now.
Unfortunately,
Yes,
it is.
yes.
Even all medication drugs. That's the thing, because sometimes people, when they hear, for example, there's a new medication in China or Japan or whatever,
They go ballistic about
Yeah,
it. And
they think
start
that's
thinking
it,
that
the end
when
of
are we going to get it in
COVID-19.
here? But it's really not been proven yet.
No. And I would say that,
Yeah.
I mean, from our own experiences, I would say that all medications are based on to relieve the symptoms, not to cure or to handle or remove the virus itself.
Yeah.
It's all about the symptoms.
Exactly. Which are really varied as up to now. Yeah.
Unfortunately, I think they said it would take around maybe till January to produce a vaccine. Maybe that's being hopeful.
Yes. Yeah.
So, Doctor, I have another question actually. So, what do you think is the difference between, for example, the situation in Kuwait and neighboring countries? Why is it so different? What happened to neighboring countries, for example? They reduced the curfew, they removed the curfew in general. Why is that?
I think a lot of decisions have been made based on various factors in different countries, be it the neighboring countries around Kuwait or other places outside of Kuwait. Factors like economy, which is a big concern in certain countries, and factors like movement of residents, expats, as well as the citizens. All these are factors which the government has to take care of. And I think in a broad perspective, the curfew decision again lies with the MOH and the government agencies. They would base this decision based on how many people are prone to get sick over a period of time, and that will depend on the past records. So it's a projection which they decide, and which is not 100% correct always. There have been situations where countries have opened up the lockdown and again reinstated the lockdown, which was required in certain situations. So I think it's a multifactorial decision. It's not one single thing which we can say that this is why it has been done.
Dr. Mohammed, regarding the cases that were testing positive lately, we all know now, it's established that underlying conditions at these people determine how COVID-19 reacts in your body. Do we know the mechanism? How is it different from person to person regarding those, in keeping in mind those underlying conditions?
In fact, any medical condition or any medical illness would vary in every person depending on how the person is. So in our medical training, they are taught to us that it's not about what disease the person has, it's about what person has the disease. It makes a huge difference. For example, I may be having two patients of the same age, but one person is absolutely healthy with no health problems, or another person maybe having maybe diabetes or hypertension. So how the disease will present in these two people differs. It could be as simple as a cold, but it's different. So the same thing applies to COVID-19. So those people who are having a pre-existing condition are more prone to more severe complications, no matter which disease. Same thing with COVID-19.
Okay.
Yeah, so it's a basic thing, I would say, because, for example, if I'm an old guy with hypertensive issues or diabetic issues, so I'd be sick. I mean, if I got infected with COVID-19, I'd have more severe symptoms, maybe.
Yeah.
Yeah, that's the thing. That's why we always say that all people should be extra careful, should not go out.
Yeah.
Yeah, and so regarding that, actually, Doctor, so what do you think, when is it safe to travel after the phases have all finished? When is it safe, or is it safe to travel up to Kuwait?
I think, again, it will depend on how healthy I am and how much in contact I am with the people who are at risk. So if I have a family back home where I have young kids and elders with multiple chronic diseases like diabetes and hypertension, I would want to restrict my travel and my contact with them as long as I can. But there could be situations where it can be necessary for us to travel, but during those situations, the whole concept of going in and having a period where you isolate yourself from the rest of the family, that's important again. So it will be subjective, but on a general basis, I think it will probably be safe to travel after the end of this year, inshallah. For any holidays or any of overseas travel, I think, inshallah, by the end of this year. And again, subject to the situations in the country that you're going to travel That is also important.
Of course it is.
Dr. Mohammed, regarding kids and the younger ages, so we haven't really noticed a high record number in infection amongst kids, and a lot of the people or of the countries that reported closing schools because of infection amongst the kids, they actually reported they were asymptomatic. So how do you explain that?
Yes, in a normal situation, the way kids grow and the way young people grow, as long as they are not unhealthy, not having any disease, their immunity is pretty strong during those growing ages. So the growing age, the immunity adapts to things very quickly. So the same with the situation is probably the situation with COVID-19 again. So most kids have a very strong and growing immunity, and they are able to resist this infection to a great extent and able to withstand it. Even the same with younger people with no health conditions. Since they are young and they're healthy, they're able to resist the severity of the disease and they're able to come out of it quickly. That also explains why there is more severity in the older age group. If you look at the global statistics, the ones beyond the age of 50 with multiple conditions are the ones who have always been worse. And I think that explains that it's more to do with how fit we are in general.
Right. I have a question that just sprung to my mind regarding immunity and how strong it is. Cancer patients and transplant patients, those are really immunocompromised.
Yes, of course.
Do we have any guidelines or anything specific that could help them try to live through this pandemic?
I think all the people who are having any chronic medical illness, by chronic I mean anything which has been lasting for a long time and which has changed your lifestyle to a considerable extent. It could be diabetes, it could be hypertension, it could be things like unmanaged thyroid, it could be things like obesity, smoking, and cancer included. Mm-hmm. See, most of these conditions have affected our lifestyle to a great extent. I would advise these people to maintain social distancing to a greater extent and to maintain a distance from people who are moving out. Stay safe. Try not to be in places where there is crowds. Yeah. Do not mingle with the younger age group, because the younger age group, as I mentioned, barriers, but they will not show symptoms. So try to be away from them. Mm-hmm. So more than isolating ourselves, it's also about isolating our elders at home. That is very important. So people with such conditions, with transplants, with heart conditions, with chronic diseases like what I mentioned earlier, my advice to them is to first try to make sure that your disease is under control and you're staying away from people who could be infected or who could be carrying an infection. So wash your hands more regularly, stay in a place where there is good amount of ventilation, and make sure your personal hygiene is taken care of, inshallah. That would be my earnest advice for such people.
And you know, there's one point I want to emphasize about is that, Doctor, for example, you know, some people from the outside, they look quite healthy and good, but for example, they might have internal issues, congenital heart defects or whatever.
Undetected conditions.
Yes, that's a point. So that's why we always say you have to be careful all the time. That's a point.
Absolutely.
So, Dr. Mohammed, thank you so much for the lovely information we had. Dr. Mohammed Rees Sharif, family medicine physician at Dahman Health Assurance Hospital Company. Thank you so much, Doctor.
Dr. Mohammed, it was a pleasure having you. Inshallah, you will see better times in Kuwait, inshallah.
Hopefully.
Inshallah, hope so too.
Thank you.
And now I think we have our next guest, Dr. Rachel Matakuti. Let's watch this report. Stay tuned. We'll be back.
Should wear a mask and what type of it? Medical mask, also known as surgical mask. It should be worn by health workers, by people who have COVID-19 symptoms, and those who take care of someone suspected or confirmed with COVID-19. In areas where COVID-19 is widespread and physical distancing of at least 1 meter cannot be achieved, medical masks should be worn by people who are aged 60 years or over and those with underlying health conditions. Fabric mask, also known as non-medical mask. should be worn by people who have no COVID-19 symptoms. Where COVID-19 is widespread, physical distancing of at least 1 meter can't be achieved. These may include people who are in close contact with others, such as social workers, cashiers, and servers. Fabric masks should also be considered in busy public settings, such as public transport like buses, shared taxis and trains, workplaces, grocery stores, and other crowded environments. Please follow your local authorities' advice on the use of masks.